The U.S. Surgeon General is sounding a very blunt alarm about kids and social media, saying it represents, and this was the quote from the study, profound risk of harm. Dr. Vivek Murthy says we're in the middle of a youth mental health crisis, and he's worried social media is just contributing to the problem. Paula Tutman digs into his warning and what it means for a lot of families.
Surgeon General Dr. Vivek Murthy is slapping a big old warning sticker on social media.
We see rates of depression and anxiety and suicide and loneliness going up among young people.
Laying out the case that with both the seeming unpeelable FaceTime young people spend peering into their devices,
you kind of have to ride that line of, knowing what's too much for them versus what's just fun, innocent entertainment.
coupled with what it is they are seeing and reading, that unchecked social media is exacting a measurable toll on the mental health of children. Dr. Tiffany Widener, a pediatrician with Children's Hospital of Michigan, sees it firsthand daily.
I cannot tell you how many times I walk into an exam room and a child is breaking out in a TikTok dance.
Screen time can average as high as 3.5 hours a day.
It's taking away from their physical activity. It's taking away from their engagement and conversations with their family.
Based on the research, when asked about the impact of social media on their body image, 46% of adolescents aged 13 to 17 said social media makes them feel worse. Only 14% said it makes them feel better. Social media engagement also puts a world of strangers at the fingertips of children.
A child is not necessarily able to filter out what things they are supposed to be engaged in and what things they're not. The other issue with that is it opens up for predators.
Also in the findings, 64% of adolescents say they are either often or sometimes exposed to hate-based content, which according to Dr. Widener can either frighten them, bully them, or indoctrinate them.
We know that individuals that are engaging in social media are a lot of times looking for the likes, they're looking for attention, and a child that is not getting the attention that they want may go into a spiral, and that will affect their mental health.
Yeah, and in terms of long-term outcomes, still not known, too early to tell. But there are things parents can do right now to minimize that exposure. First of all, find out what those parental controls are and actually use them. Make sure you limit maximum screen time and make sure you're talking to your children about not only what they're doing, but also what they are seeing. Devin?
So important. And this is hopefully the beginning. I think we're in the middle, Paula, don't you, of really a national conversation about this, but this is maybe the fuel it needed.
Yeah, it's still early in the game.
Yep, exactly right. All right, Paula.